Hey everybody, welcome to MedList. I'm Kevin and this is Donna. And Donna, what's been going on lately? Anything good?
Yes, always good stuff. I started thinking about this. I listening to some podcasts, etc. And it's so important the positive things that we put into our brains, and it just allows for a positive day. So I started saying to myself when I wake up in the morning, today's going to be a great day. And then something cool is going to happen. And lo and behold, the last few days, that's exactly. I've had great days and really cool things have been happening. So
Love it.
I
I
like
love
it.
it.
I like it a lot.
I think those positive affirmations and always looking for the positive elements in life can be so helpful. I think that, sometimes when it comes to, waking up, the social media feeds can be really brutal on someone's psyche. So I'm sure our upcoming guest can maybe touch on one of the wellness components about unplugging every once in a while, because I think that can be a real blessing. At least for my family, unplugging can be a huge benefit, especially when there's some tumultuous times and different thoughts on, political elements, all of those things. Kind of pulling away and recentering can be really good, especially having conversations, I think, with people, real conversations, not ones that you're sending messages back and forth, right? Literally talking to someone. I know you and I get to talk online, but those things are so important, like keeping those connections, keeping the communication lines open, seeing someone's face and their reactions. All of those things I think can be essential when it comes to cultivating a good relationship, with the people around you. And I feel like when it comes to American history and this time, there's nothing more important right now than cultivating really good relationships. I think spiritual relationships and our relationships with God, and a lot of relationships with our friends and family, really right now. And I think that one thing will be a lot of fun is when we talk to our next guest that's coming up, which she's amazing. And I know Donna sent me her link before we started, and I thought, gosh, I need to start working out. I think there's a picture of like Kelly with six-pack abs already, and I'm like, holy smokes, I need to really hit the gym here sometime soon. Is finding people that inspire you, like to do better and to do new things and to connect with. And so those can all be massive. The one thing that can separate us from some of those opportunities, though, that you and I know really well, is just the cost of doing things. And one of those is medications. On how do I afford these medications? I know these are going to be better for me. I may be able to bridge the gap between where I am in my health using these medications and getting to another place. They could be necessary for some very significant treatments that are happening. And sometimes they can be a significant burden. And I'm very thankful. I know Don and I and Tim are very thankful for our sponsors in Remedy Chain to be able to add to some of those solutions.
At Remedy Chain, we know throwing away perfectly good medicine feels doubly wasteful. It's bad for the environment, and it could have been used to help a fellow human in need. So we found a remedy. Now you can donate your unused meds. Our pharmacists inspect and certify every donation so it can be safely and legally redistributed to vulnerable patients. Visit donatemymeds.org and click the Donate Meds button. Unopened, unexpired medication in original packaging is eligible for donation. Open bottles, controlled substances, and temperature-controlled meds are not eligible for donation. Once confirmed, we'll send a donation form to sign and prepaid shipping instructions. And we'll let you know once we've matched your donation with a patient in need. Together, we complete the chain. Remedy Chain. Visit donatemymeds.org today.
Awesome. One thing that I get told oftentimes by our producer, Tim, is, Kevin, make sure you're targeting the audience and letting them know if they have any questions or anything else, to shoot them in the comments. So feel free, if you have any questions, we'll just absolutely put Kelly on the stand to answer just everything right off the fly. Just kidding. We will be able to respond to you later on if we can't get to you during the show, but we really appreciate any of those questions that come along the way. And I'm sure with this guest, you'll have lots of great questions, and I'm going to add her to the stage now.
Yeah, so thank you. And thank you so much, Kellie Hamilton, for joining us. And I want to share a little bit about you. So Kellie Hamilton is a dedicated holistic nutritionist and ICU nurse who helps individuals prevent and manage chronic diseases through nutrition education. She specializes in improving lab values, providing strategies for weight loss, and empowering her clients to achieve lasting health and wellness. With personalized coaching, Kellie guides clients toward sustainable lifestyle changes that not only address their immediate health concerns, but also foster long-term vitality. Her approach is rooted in evidence-based practices designed to help people take control of their health and lead balanced, healthier lives. You can learn more about Kellie and her company, A Better Path to Wellness.com, by clicking on that. So, Kellie, thank you so much for joining us. And I know we've met probably a few months ago now at this point, and I think our connections just keep connecting and connecting and connecting. So I love our circle that we are definitely a part of.
Yes, thank you guys so much for having me. It is a pleasure to be here. And you're right, we were talking about our 6 degrees of separation before this, and just meeting people who know you and seeing you everywhere. And I got to meet Kevin today, which is so lovely. And yes, please, I love on the fly questions too. So if there are any, I don't mind being blindsided. Kevin, hit me with all the questions. We want to make sure everybody gets their info. And I love that I've inspired you maybe to hit the gym or pick up something heavy. So already.
I love it. So Kellie, please tell us more about your path, if you will, this whole ICU nurse, and then becoming a holistic nutrition coach. Just really is, I think, one, inspiring, like we talked about, but not your common road, if you will, I don't think. So just share with us, I know you told me your story at one point of some of the things you were seeing, and then, gosh, we got to make a difference here.
Yeah. So I've been an inpatient nurse in a couple different specialty areas over the last 11 or 12 years now. I spent the last 8 and still are practicing part-time in the ICU. We see a lot of surgical patients, a lot of medical overflow. And it was day in and day out of taking care of a lot of, medical surgical patients, whether that was in the med-surg unit or the ICU. And I just thought to myself, we could get so much farther ahead if we caught these people like years prior in the system. And it really got my wheels turning. And I didn't really want to transition to the outpatient side. I still do like to do a lot of inpatient stuff. And then COVID hit, right? And a lot of practitioners will tell you that, it made us think very differently. And I thought to myself, I don't know if this is something, if we're going to practice medicine like this for the next, umpteen years, if I can do this. So I wanted to have, I don't want to necessarily say a backup plan, but I wanted to do something to synergistically go with what I was doing that brought me joy, because the ICU nursing world in that time frame was a very dark place to be. And not too many people can say they were physically pushed into business. I was doing kind of what I'm doing now, a little bit under the table for friends and family for quite a few years before A Better Path to Wellness launched officially in 2021. And my friends and my coworkers basically handed me a fistful of masks and said, go to City Hall and apply for a permit and do it. Don't wait any longer. And it was really the beginning of my whole story, because I had no idea what I'm doing. I've never taken business classes. I didn't know how to own a business. I've learned everything self-taught from the Chamber of Commerce and SCORE mentors, and just doing it trial by fire. And people responded. I really genuinely think I did not realize how well received holistic nutrition coaching, was going to be. And I thought, if I help 1 or 2 clients a month, that'll be great. And it just exploded. And I could not be more thrilled to now offer screenings and one-on-one coaching. And I function as a mobile lab, and I do collaborations. And it's just, I get to meet people like you and Kevin, and we're even talking about collaborating because we live in the same city, which is even more amazing. And I just really am so thrilled to be a part of holistic nutrition and healthcare, not just allopathic medicine.
Yeah, 100%. It's great. And can you share a little bit too? I know that Kevin will like this with his background too. I remember you telling me about certain meals or something, or you would help people learn to cook healthier meals. Am I right with that part of the story? If I have that.
Yeah.
correct?
So when I first started, I was doing like meal prepping services for people who wanted to go plant-based, but were like petrified. And they thought all they were going to eat were like boring salad, like kale. So friends and family would contact me and they'd say, can you like meal prep us meals when you do your own preparation and we'll pay you for said meals? Now, obviously the pandemic hit and I just felt like, I shouldn't be doing that, anyway. I'm working with COVID patients. And I was flattered because people still were like, no, please cook us food still in the middle of a pandemic. And I was like, I'm flattered, but we have to transition away, which got me thinking. And I was like, teach a man to fish, or give a man a fish. And I said, why don't I teach people how to do this instead of do it for them? So now I've even hosted a couple like meal preparation seminars. I've toyed with the idea of doing like a meal prep workshop where I go into like a factory kitchen and have people come in and we'll make a meal together. There's the food hub that just actually closed and reopened in Worcester. So I'm kind of waiting for them to get reset up before I pitch that idea to them. But yeah, if people are struggling, like Kevin, if you're like, I don't know what to make for dinner, or, I want to try some meatless Monday meals or something like that. That's kind of where I got my start doing that for people.
Amazing. No, I love that the culinary background kind of comes into play as well. I did have a good, a kale joke for you though. I heard that cooking it with coconut oil is the best because it allows you to slide it off the plate and into the garbage more quickly. That was the
yes.
But
that's a good dad joke. That's a good kale dad joke. I'm gonna keep that one.
Dad of two little guys, and so I've got to use those as often as I can. But in all seriousness, I think the educational component when it comes to changing your thoughts on food, there's some interesting behavioral psychology cooked in. Into that space. So tell me, what are your experiences of going from trying to teach a man to fish to having them actually move forward and be successful in cooking their own meals?
People are nothing if not like moldable, right? Like we push back against change, and everybody's different. There are your people who are very receptive to change, but mostly as humans, we like routine. We know what we like. It's hard to get, especially the older people are, it's very hard to get them to change some habits that they're making. So whenever I approach it with somebody, I always approach it more like I'm not telling them to do it. It's an option. Hey, and I give people homework when you work with me one-on-one. And I like to say, I give you 3 different assignments, pick one. And a lot of times people will pick the food one. They'll want to make a new meal that week because they know that they have me for feedback and to walk them through that. And perfect example, and again, I want to preface, I have a plant-based specialty, but I'm not like a vegan or a vegetarian coach. I work with all people. But for this particular example, because I know people might like go running for the hills, I had a specific couple who I was working with that wanted to try tofu because they kept hearing about it. Again, it's not my most favorite food, but they were like, we would love to see if it's something we could work in like once a month to rotation, and I said, so I gave them, a homework assignment, and I said, these are all the different things you can do with it. You pick one, let me know how it goes. And they loved it. Even her husband. And I find it's hard to get the husbands on board with a lot of the plant-based stuff. They are the ones that give the most pushback, and you really got to like wow or impress. But she could not wait to call me up and be like, my husband loved it, and we're going to do like, tofu Tuesdays once a month. And I just thought that was amazing. And it was just getting over that initial fear of never having done it, never having made it, and having, somebody to bounce ideas off of. And I think it can be that simple, and people can do that. There's so much information and recipes on the internet now. Don't be afraid to try something new is what I say. Worst case scenario, you won't make it again. Best case scenario, it's going to be a staple in your weekly meal rotation and really nourish you.
How did you grow up, Kelly? What were you cooking at home when you were a kid or kind of going into high school, college age, and then your husband and you? What were you guys making together? And has this been a learning and growing process for you? Have you always been a very health conscious meal preparer?
So it's so funny that you say that. And I'm going to have to send this to my mom because my mom was known as like Miss Square Meals in college. And she loves to tell that story because she would always have her protein, her carb, and her vegetable. And, all of her college roommates would laugh. But my sister and I were raised that way. So, all through cooking and all the sweets and stuff in college, I always made sure I had, the very well-rounded meals. And then as I got more into functional nutrition after I graduated nursing school, I started learning more about what plant-based is and what, the Mediterranean foods, because we're Italian, my dad's side's Italian, my mom's side's French, and we didn't really eat a lot of cultural foods growing up outside of, Mexican here and there, tacos, fajitas, things like that, and spaghetti and some Italian staples. But I just was like floored. I was like, oh my God, there's all these foods out here. I had never had lentils before. I had never tried quinoa. And in my early 20s, I just thought, I'm going to just start exploring, and what I like, I'll continue to put in my pantry, and what I don't, I will tell people, hey, I didn't like that. I'm not going to have that again. You know what I mean? And now it's so funny that you mentioned my husband, because my husband and I have been together for 4 years now, and people used to laugh when we started dating, and they're like, oh, you're dating the earthy, crunchy, plant lady. And he'd be like, no. And he was such an advocate to his friends. And my husband's also in the military, which is a hard, beefy meat and potatoes group of men to impress. And he would say, oh, my wife made these eggplant pizza rounds that were so good. And his friends would be like, oh, yeah. And they'd be like, what else? Nobody wanted, oh, well, what else? It was like, oh, she made this really great lentil loaf. It tastes just like meatloaf. You'd never know the difference. And they were like, oh, we like meatloaf, like we do. And it was like subliminally messaging them kind of into being open to it. And now they just always ask, like, what's your wife making now? Like, what'd you eat? And I feel like it really took the stigma out from around, plant-based cooking and Mediterranean food for sure.
That's awesome. I love that. I think that one thing, some of the folks that I work with in the food science space, they talk about the need to be able to sneak in some things just so people are exposed in general because of some of the flavor profiles we're used to. I think the eggplant and some of the vegetable components are ones that oftentimes have to be snuck in initially and then can be introduced in small kind of doses. The sampler idea, though, and the commercial kitchen utilization, I've seen more and more companies out there, Kelly, that are now kind of going into that space, that are doing in-home cooking, teaching cooking classes, even some universities and professional organizations trying to do that on a scalable level with group teaching classes, especially in Texas, that they're buying individual facilities, bringing in patients to make sure that they're benefiting from those things. Who do you think are the right fits when it comes to individuals that are going from, I'm thinking about this, I'm thinking I should do something healthy for myself. I'm thinking I should work with someone that is looking at holistic, plant-based, potentially, maybe not always, right? Nutrition. Who are good candidates for that? Why should they try it out? When should they try it out?
Yeah. And I love hearing that. I didn't know that that's a very big Texas thing that's happening right now. So I love hearing that other parts of the country are kind of jumping on board with this. I think it's such an underutilized service. And I think people that are a good fit for me are people who maybe you've gotten some lab work back that's concerning. Your cholesterol is high. Maybe you have some new hypertension that's, been creeping up over the last few weeks that you've been watching. Or you got a diagnosis. I just had a woman approach me who got hit very early on, in her early 40s, and hit very, very hard with Parkinson's. And she was a nurse. I could empathize with her truly, and it's a lot to be hit with something like that. And I'm finding that these people who call me for the free consults that I offer to talk to me for about 20, 25 minutes, and I give them the most undivided attention, and I really listen and I really empathize, because these people will call me, and not know me from a hole in the wall and pour their souls out to me. And I think nursing being a nurse gives me a lot of credibility, right? Anybody can go do a nutrition program, or, I'm a certified holistic nutritionist through a program. Anybody that wants to do that can do that. But to add the nursing piece on, people trust you. They want to, we're one of the top, I think we're always in the top 5 most trusted professions that come out every year for the last 20 years. And I said to her, did any of the specialty physicians, of course, because she's seeing now endocrine, and she's seeing a neurologist, and she's got a PCP, and she's got all these. And I said, has anyone told you how to fuel your body appropriately during this time? And she said, absolutely not. And when she brought it up, because she knew to ask, to advocate, as nurses, we know a little bit more than the average, patient does. she said she was basically told to like do her own research, which, I mean, when you get a devastating diagnosis like that, a new chronic disease you have to live with for the rest of your life, the last thing you want to do is go home and go down a rabbit hole, of information that you don't know what's tried or true or evidence-based.
Yeah.
So that's just one example, but, anybody who really has sat there and thought, I've tried this, maybe I've lost, the 10 or 15 pounds I needed, or I've reversed, my A1C was 6, but it's now like 5.7, but my doctor's still on me, or, you just need a little bit of accountability. You need a little bit of help. I would be happy, to work with them or refer them if I couldn't help them to somebody that could, because I think having the accountability piece and having somebody in your corner who is cheering you on mentally and physically and checking in with you is huge. And I think that speaks to psychology too. You can do more when you share your goals, when they're shared, when you tell people what you want to accomplish, all this stuff adds up when you talk about success and what it looks like.
I like that. And I love that you're kind of incorporating individuals that are at a critical juncture, in their kind of medical treatment. If they've just been diagnosed with something or just been prescribed with something, how do I look at this more holistically to be able to take care of this disease state or problem, et cetera, that doesn't become a label for me, but becomes something that I can be able to confront, with my own abilities to take care of myself and my body with fueling it appropriately. Other than giving people fantastic food, you mentioned several things before we started the show of kind of you said pie slices that you think are really important for people to think about a little bit more holistically. And so just broadening the conversation from food-based kind of components that we want to incorporate in daily lifestyle and educating folks on how to do next steps. What other things, have you kind of brought into the fray with those individuals that have just been diagnosed or have found Kellie online to say, here's other things we could look at kind of working on? How does the whole program kind of work holistically?
Yeah. So I do a very thorough intake with my clients, and some people might find it, I don't want to say invasive, because I think a lot of people are used to filling out, paperwork and stuff when they go to the doctors, but what do they do with it, right? A lot of people are like, well, I fill out the same form every time I go. And they're like, do they throw it away? But I use the thorough intake that my clients provide for me, and I build out their whole plan custom to them with that. So I ask you everything from how is your sleep? How many people are you cooking for in your home? We're nurses. We love to talk about bowel movements. Donna knows that. She hears us talk about all the time. We're asking people about the quality, the quantity. We want to know about the stool. Nice. And that's just a small piece. We talk about everything from what do you do for physical activity, right? That's a huge piece. Even though I'm not a certified personal trainer, I want to know, how are you moving your body? How do you get play? How do you get exercise? What are you doing? Making sure it's enough. We briefly talked about like spiritual wellness, sexual wellness and health. These are huge, huge, we talk about pillars or pieces of this pie. And I think it's unfair in healthcare, which we do very frequently these days, to segment and specialize every system in the body. They're all connected, and they have to be treated as so. And I think when you work with a professional, if you want to make sure you're working with somebody that's doing a good job, look for these cues. Are they asking you about more than just what system you're there to see? And that's how you know that they are trained well and that they do care about your overall holistic well-being.
Before I pass it over to Donna for I'm sure a set of questions that I'm seeing her furiously write down, the next steps is this. So we have a whole healthcare paradigm that Donna and I talk about with a number of guests we've had on, that work from every kind of stage of life for individuals. Where do you feel like a holistic coach fits? Like where in the grouping do they fit? Who do they end up coordinating with? What groups of individuals do they connect with?
It's so funny that you say that, because I was told, as I said, I didn't know a lot about business when I started my business, right? And I was told niche down. Okay, chronic disease, holistic coaching is too broad, and you pick an avenue, pick a disease. And I thought to myself, as I did more and more research, I thought, all of the principles to treat them almost are the same. Like fundamentally protein, fiber, gut health. You can solve a lot of the same problems without only treating one population of people. Mm-hmm. So I refuse to do that. And I still get criticized for that in certain circles for not doing that. But I have helped new moms, in that postpartum period and the antepartum period, I've gone to senior centers with my partner, Phil George, and we've done lectures, for the elderly, and then everybody in between, depending on whether you just want basic weight loss or you just want help, going over your lab work and how can I get some dietary preferences to improve my cholesterol, or you have, a full-blown autoimmune disease that is wreaking havoc on your whole life. And I just kind of refuse. I don't want to say refuse not to help anybody, because there are people outside of my scope where that's not my specialty. And I have people in my circle, like Donna, and that do work with certain specialties, and that's, their niche. And I'm happy to refer to those people. But I think we're missing the whole concept that if you have the basics and the fundamentals, you can catch people way ahead before all that stuff happens and before they need that individualized niche down care.
Great.
There are so many diagnoses that you hear, it really started 10 years ago. We say that with diabetes, we say that with Alzheimer's and various different types of disease states. But so I'm going to date myself a little bit. And so you're talking about Kevin a little while ago in regards to, learning to cook and doing that in the school systems and et cetera. Years ago, there used to be this thing called home ec. It was home economics. And we literally took cooking classes when I was in middle school. So you took cooking classes and you learned how to, finance a household, and men, women, like boys, girls, we're all in this class together. And I was cooking with my partner who was alphabetically next to me, in many of our classes. So, but I remember those days. I remember home ec class, and I think a lot of people out there are probably laughing hearing about that, and maybe remembering their home ec classes too. But interesting what they might be bringing back, right? Is like, oh, people need to learn how to cook. People need to learn how to, get through their finances and that whole
balance a checkbook. Who does that these days? Nobody, right?
Financial literacy. It's such a big deal for people. But I would love to know, I'm going to give you a couple of examples, if you will, because we've mentioned cholesterol a couple of times. And so there are things like unfiltered coffee is known to increase cholesterol levels, especially probably triglycerides, I think, are a big deal with that, but an LDL. So it's better to use a filter for coffee when you're brewing coffee so that it actually helps and you're not causing your cholesterol levels to increase. Oatmeal is also a really good product to reduce cholesterol levels. So, I'm thinking about some of these things that we can do with our diet. Can you tell us or share with us a couple of other, big or little tidbits that might just help people in general about, what are some consistent things you see that people might be deficient in or not really know, but should really be mainstream at this point?
Oh man, you could have opened with that question and I could open-ended answer it the whole time we have left. I love fun facts. So if people love this kind of stuff, you have to check out my social media, because I love to come on and do these like under 1 minute fun facts with people. And that is basically what I answer almost several times a week for my community. But I think for talking about just cholesterol, quinoa is a big one. People don't realize they've actually done studies, 12-week studies with people who have had elevated total cholesterol and LDL levels well over within normal limits of Western medicine. And for 12 weeks, if you have just a fourth of a cup of quinoa, they significantly lowered people's cholesterol levels by like over 20%. And that's something that's not going to cost you a lot of money to do. That's only going to, Google like how to make quinoa, or, ask me, I'll tell you, it's very easy. Another one is hibiscus tea. So we see a lot of people on antihypertensive medications. And one thing I do find with antihypertensives is that people don't get reassessed on them well. I feel like you get put on an antihypertensive and then your blood pressure goes from, hypertensive stage 1 or 2 or pre-hypertensive to normal. And then they just go, okay, that's fine. You're going to live on this now for the rest of your life. Instead of being like, okay, well, we brought it down out of crisis mode or, out of, the panic stage. let's try coming off of it and reworking and adding in some lifestyle factors like, whole grains. A lot of the things for cholesterol also help with hypertension, but hibiscus tea is a big one. It costs you, pennies per pound. And as long as hibiscus tea is that first ingredient, I know red zinger tea is good, but it can lower your systolic blood pressure anywhere from 6 to 10 points. When you have 1 to 2 cups of this a day, and this is something you can just dilute and walk around and have in your water. It's high in manganese, so you have to be careful. Obviously, you can't go too crazy. You can't drink it like all day, every day, right? This is why you need a professional to tell you, because food is, I hate to say like food is medicine, because I think we need medicine, right? But food is powerful, and it can be very powerful, but you have to use it correctly, and you have to know and work with professionals that use it appropriately. The other thing is, I get asked about supplements so often, and everybody wants to just, take a pill for something. But, going outside with no sunscreen on, with your chest and your arms exposed, getting vitamin D, there are a lot of people who can't synthesize vitamin D. And I truly believe to my core, we need to supplement with vitamin D year round, especially in New England, where we live, and in Northern Washington, where Kevin is. And I think, but even just a little bit of natural ones that you get, that's not even a food, that's just a lifestyle piece. And then pairing it with high vitamin K foods to make sure you're really getting an ample dose. I think that I could go on and on, but I don't want to bore you with all my fun facts, but
no, I love it. So how do you determine with someone, you go through their whole history and then you kind of tailor a meal? Like take us from start to finish, if you will, like the steps that you do with your patients.
Yeah. So I always offer a free 25-ish minute phone consult. I get, I always say, tell me about you. Tell me about your journey. Cause I have a list of questions, right, that I want to ask or that I need answers. But I find if I have you tell me your story, I can get 90% of the information that I need. And then I can ask my directed questions at the end. And people like that better than just being rattled at, right? So we start that way. If we think we're going to be a good fit together, I direct them to my website. I'm one of the only practitioners in the area. I list all my prices on my website. I feel like if you want to invest in coaching to better your health, you should know what the upfront investment is. Unfortunately, holistic nutritionists are not seen by insurance at this time. I hope I live to see that changed. So I am direct pay. So I do tell people, I never want cost to be a barrier. We can set up a payment plan. We'll figure it out, right? If you feel as strongly to work with me as I want to help you. So again, you have to be a motivated individual. So they usually will look at my website. They'll talk about it a lot of times with their partner, because usually it's, my clientele I do take on. I do not do pediatrics, full disclosure. I think, Kevin, you asked me like who I work with. That's kind of the only population that I do not work with. I do take on, college students. I have taken on a few, older high school students with their parents' help that really needed some services. But again, so whether you're married, I say, talk to your partner. If this is a good fit, we'll follow up. And usually by that time, they get to look at my site. They get their questions answered. They ask me additional questions. I recommend a package for them and we move forward. So then I send them, a contract agreement. I send them my intake. I want to send them a food diary. I want to know, hey, show me 3 to 5 days of what you eat on a typical day, because that's going to give me a great picture. And people always go, they grit their teeth and they're like, ooh. And I go, don't lie. I want to know. You're not going to, they go, oh, I think I'll shock you. I go, you can't shock me. I've seen it all. So I look at all that and I sit with that. And I usually tell people, depending on how many clients I have at that given time, I'll sit with that for about a week. And I will thoroughly go through every single piece of that client intake and food diary. And I come up with, ideas for you for macros. If that's something you're interested in, I calculate out your macros. We talk about fiber, because if there's anything that I've learned in research about fiber this past year, is this like gen beta and alpha, which are basically like all the kids that either haven't been born yet or for 0 to 5. We are going to see gastrointestinal rates of cancer in this country when they reach adulthood like we have never seen if we do not get them to eat more fiber. Again, men, just for reference, if you're sitting here listening to the podcast and you're wondering, oh my God, how much fiber do I actually need? Women, we need 25 to 28 grams every day. Men, you need 35 to 38 grams of fiber every day. You definitely should be tracking that. So we talk about that. And then it just goes even more kind of patient specific from there. So if they have a past medical history of, we talked about the mental, health. If you have anxiety, depression, I create a care plan for you for that. There's a lot of nutrition around mental health that I really don't feel like we're educating people on in this country, especially in this day and age where we need it now more than ever. Then we dive into maybe the heart health, maybe that's in your past medical history. And basically every session we do an education topic. And then I give them homework. We reassess the homework. I check in with them in between sessions. They have access to me. That's a privilege you get as a one-on-one client. And accountability is huge. I find my clients that utilize that accountability piece with me are so much more successful. They like the check-ins. They like to know that someone's peeking into their MyFitnessPal diary. A lot of my clients like to use that. So I'm well versed in that. And I know how to, do all the odds and ends with that. And I really just want to provide a really great level of individualized care for each person.
That's awesome. So you said that you didn't want to niche, whichever one of the two pronunciations you want. But with that, I love it. Like, I think in general, if you are a healthcare practitioner and you really understand how systemic all things are within healthcare, having a specialty ends up becoming very problematic for a lot of patients. But I'm going to ask you a question into that. If you had to choose, like, where are you the strongest? Like, this is the skill set that I've really helped patients with and I've really focused on. And this has really been a go-to for me, for my either clients or within the ICU, whatever setting of life you want to talk about. Where is that right now for you, Kellie? Like, where do you feel like your strength really lies?
Oh, that's a good question, Kevin. I don't think I've done a lot of podcasts. Nobody's asked me that question. I think that I have seen so many neuromovement disorder patients in the last, I'd say 2.5 years of my business. And I'm involved, and Donna has spoken for, we have a friend, Leah Halloran, her Parkinson's group, which is a free resource here in Central Massachusetts for anyone with Parkinson's. If you want to know more about it, please email Donna and I would be happy to direct you that way. She's growing an amazing program with that. That I feel confident enough now to, I even actually was thinking about networking with a couple of neurologists, because I really do feel like these patient populations are so underserved and they're not being told. Like, I had one woman who's been on Parkinson's meds for like 15 or 20 years, and no one even told her, like, I didn't know I can't take my Parkinson's meds with my food because I'm supposed to take it away from the time I have protein. And it hurts my heart to hear something like that, because when you've had a chronic disease for almost 2 decades and no one in the medical space is sharing this information with you, it like makes me want to be like, what? Like, it's hard not to have a knee-jerk reaction when you care so much and you empathize for these people. So I think that is an avenue I'm getting very confident in. And then just macros in general. I have patients, and I do macros for almost all of my clients, whether they want them or not, because I feel it's important to know how the body works, right? And when I say macros, I think it's important to note, I'm not talking about like calories, carbs, protein, and fat. I'm talking about fiber, calories, and protein. That's what we focus on. And I only focus on that with my clients. I think unless you're competing for like Mr. Olympia or you're a bodybuilder, there's no need to get or a brittle diabetic. There are a couple populations, right, that need to understand how net carbs work and carb balance work. But sure. The average person, if you're eating the right amount of calories for, your target weight, and the right amount of protein and the right amount of fiber, if you can focus on those 3 things, it's very difficult to eat out of balance with everything else. And that's what I want to drive home for people. And I make it really simple. And people go, really? Like, that's it? And I'm like, yeah, that's it. and the scale starts to move. They start to get more energy. I just had a client a couple weeks ago say to me that she was saving a pair of, the high-waisted mom jeans that she hadn't worn in 10 years, took them out of the closet, was able to get them on,
Right.
and I share that joy for them because they're literally just putting these basic foundations into practice, and now they're going to know it for the rest of their lives. They can teach it to their family members. It really like pays itself forward.
That's super helpful. So with those that you've kind of specialized into, because you're getting so good at them, what technologies have you deployed to help those patients in particular with the macros and with the movement disorder components to be able to help them not during the Kellie conversation, but between the Kellie conversations?
Yeah, great question. So I use NutriAdmin as my software. I love it. I think it's very versatile. My patients love it. I've gotten great feedback. So I've used that for a couple of years. And then there are so many apps out there that I really let the clientele pick. And I give a lot of options. I'm not like affiliated with anybody in the app space. And I did that on purpose. I have my kind of like younger tech savvy clients really like MyFitnessPal. That works for them and I'm well versed in it. So I help them set that up. I love, I don't know if you're familiar with Dr. Michael Greger. He wrote the How Not to Die series. It changed my life. Actually, I met him in person. What an amazing guy. He's kind of the reason why I started doing what I was doing. One of his books was one of the first ones I ever read out of nursing school. And he has an app, the Daily Dozen app, which is more check boxes. So people who either have like eating disorders, who I don't work specifically with people with eating disorders, but I have taken on a lot of clients that have that in their past medical history. And we have to be very careful about how we have a conversation around food, right? They're a very specific patient population. So for them, weighing every single thing and logging all their macros, right, is we go, okay, wait a minute. Maybe we should start with checking boxes and how many servings of vegetables did you have today? And how many servings of fruits? And did you eat 2 cups of beans? And they love that because they just pull up this app. There's a bunch of check boxes and they check it through their day. And then they send me a screenshot and say, look, I checked almost every single one of my boxes today. And that works for them. So that's the Daily Dozen. That's a great one. People can check out. That's free. I work with a functional medicine provider who uses Chrometer. He really likes that. So I had to become well-versed in that, more so because a lot of the patients that were coming to me from them were using that. It's a great app. And I had my mind blown that Weight Watchers, because who doesn't know someone who has done Weight Watchers in the last, and I'm going to date myself, Donna. I can remember when my mom did Weight Watchers when I was a kid, and it was a book. And she had to log everything and write the points in the book with a pen. And I laugh now because I'm like, now they have an app. And people ask me about Weight Watchers. And I'm like, oh, I think it's great, but it's missing stuff. I had a client show me the interface recently, and they even track your fiber and your protein for you in Weight Watchers now. So plug for Weight Watchers. I'd like my cut. Thank you. But, but even if that's something you just want to try to, reel in and get a little bit more control over your life, you can track those 3 macros. Obviously, the point system is more of the calories, right? It's not going to show you the calories, but you will still get those other macros that are really pivotal to your health.
Yeah.
Awesome.
That's, I think it's amazing how, to be tracking these 3 things and how important it is. I want to go back a second to when you're talking about, some of the medications that people might be taking, and there's certain food labels that go with it. So, don't take at the same time as protein, or don't take at the same time as dairy, or don't,
Yes.
or your green leafy vegetables and things like that. And then people just avoid. And then they get into this whole avoidance, and then really a malnutrition, if you really think about it, in my head. So, so how can we, as healthcare in general, no matter who's listening on the healthcare side, how can we do better as healthcare providers to really sharing that information and not making it so that patients avoid and then get into these malnutrition type of scenarios? How can we do this better?
I think it's all in the language that's used. And I'm thinking about this in real time because I've never really thought about this until you literally just asked me this question. But I think that when and I've seen this firsthand on the inpatient side, right? Because they come and they do rounds in the hospital, and the whole team of doctors show up, right? And they line the bedside and they stare at the patient in bed and they go, do not take this with grapefruit juice. And the patients go, I can never have grapefruit juice again, right? Like they're like, and it's like, same thing like what you're talking about more broader with like vegetables and protein. That's a huge group, right? That we need and that we're lacking. So I think we need to be better in medicine, and no matter what specialty you're in, having well-versed conversations. I think there still is a God complex around doctors and physicians and practitioners and what they say, and especially depending on the age of the clientele. I find this with my 55 and older group, that whatever the doctor says, they are going to follow to a T. And I see this with my own family as well, where I love to give a little bit of my 2 cents depending on what's going on. And they're like, no, but the doctor said. And I'm like, right, but here's like 18 different research, articles that just came out in the last year that your doctor probably didn't read or have the time to go over with you, or isn't getting reimbursed to have a 15-minute nutrition conversation with you. So I think to answer your question in whole, that instead of saying, you cannot have, or, it should be, you shouldn't have, or let's figure out what time of the day you take this so that we know plus or minus an hour. I think people need like stricter or better guidelines if you're going to give them to them, or to have like empathetic communication where we really pay attention to these keywords we're using that patients hyperfixate on.
Right. I know that there's been studies out there before that, given so many medicines, how would you actually take these type of things? And it can be anywhere between, someone's actively taking a medication 14 times throughout a day, when it could just be 3 times a day that they're grouping some medicines together, if that's the case. Yeah. Hopefully people aren't having to take that much. But again, helping with that scheduling and having people feel freer about not being tied to medicine, but being tied better to life and lifestyle and feeling better. So I think that that's a really important factor to put into, when we're looking at medicines and looking at food or diet and exercise, how are these all combined together? And so I think, I am going to touch for a minute just about the 4 M's, Kevin. I know that we both talk about this quite a bit, but thinking about, what matters most to the patient and what are the medications and how are those either affecting the patient, good, bad, or indifferent, their mentation, so cognitive skills, are medicines even causing some issues with cognition, but, are they unable to socialize because they are inside trying to figure out which med they're supposed to take when, instead of going out and enjoying life. And thinking about that and thinking about mobility too. Are they able to move? And I always think about our medications causing folks to be dizzy, lightheaded, whatever. So therefore they don't want to move. They're not comfortable moving. They don't want to fall, etc.
Yes.
So I think that there are all these factors that are really important, but adding in this whole lifestyle and diet and really working it around medicines is so important. So I would love to know from you, when you are working with patients, is there that option, or have they started to say, oh, this is better, and now I don't really need this medicine anymore? My doctor was like really wowed about what just came back in my labs. And so now we're talking about reducing some medicines that I'm taking, or whatever it might be. Have you heard those stories? Or is there a response to that where, we don't want people on medicine forever if they don't need it? And they tend to not, because their bodies are changing.
Yeah. And now I have you as a resource, Donna, right? So I've shared your information with several patients since I've met you. And that's just the beauty of the space we're in. I always call it my growing Rolodex of people, to make resources known. But yes, and that is one of my favorite parts of my job is, the follow-up and hearing from people, and I get so excited. I have 2 clients right now that are meeting with a PCP at the end of October, and I'm already like chomping at the bit, like waiting to see, what they say. I just had one woman who decreased her A1C by like a 1.5 in just like less than 35 days, I think, or something like crazy, which is rare because usually they check it like in 3 months, but her PCP was very thorough and said, I don't know, maybe she wanted to see how legit it was, but let's check it. And she was like, oh my God, this came down. And, they were talking, metformin and, GLP-1s and a lot of diabetes medications. And this woman no longer has to worry about having that conversation now. My favorite one is the cholesterol one, right? Anytime we can save anybody from being on a statin. I do have a couple clients who, most of them find me when they're not yet prescribed it, but they're being what I call like pad threatened. You know what I mean? They show up to the appointment and they're like, we really got to write this script. And, you really need one. And they go, wait, give me 3 months. Let me find somebody. And I happen to usually be that somebody, which I'm thrilled. And, and at the end of 3 months, we get that cholesterol down and they walk into their appointment with their lab work and say, you can put the pad away because I don't need it today. And I get so much joy out of that, because if that's not a testament to what we're doing works, I don't know what is. I mean, people love to see numbers and we talk about weights on a scale a lot, but to me, if I can prevent you from going on medication that you have to pay out of your pocket to be on and, take every day. And like you said, live. How many people say, oh, you should see my pill box? I'm sure you hear that, especially with your students, probably, 4 or 5 times a week, I had to guess, and even just with my own family, sometimes I go on vacation and I see all the boxes that we have and I'm like, what are we doing, people? Like, come on, and it really is a testament to the foundation of functional nutrition, that it works if you work it, and that food can really be powerful to help reverse a lot of these chronic illnesses and issues that we treat medication with.
I love this kind of systematic overview. And I think the other piece, Kelly, that I'm really curious to get your thoughts on is this. You mentioned being able to use a holistic approach to be able to avoid some medication overburden and some other components of life that just are unnecessary for a patient to be able to go through when they can be able to take control of their own health, which I think is fantastic. But the 3 of us on this call all know intimately, probably from all diverse angles, how difficult that is because of the current system that we're in inside of the medical world. Give us your thoughts on these things. And Kelly, if the worlds that we've been in, so for example, if I'm working with an app developer and they've created something that is absolutely fantastic, it's going to decrease someone's A1Cs, it's going to decrease someone's health outcomes. An insurance payer will not pay for that unless it's at significant scale and it can happen within 1.5 years, right? And so holistic long-term health is not something that is prioritized within our current medical system, right? There's an acute juncture that you mentioned when you said the doctor may not be getting paid for a 15-minute nutrition counseling component in their fee-for-service visit they're having with you for 7 minutes. If Kelly had the magic wand to be able to redeploy some of these things in healthcare, including maybe holistic care and the wellness kind of component, how would you inject the things that you're trying to do inside of the typical experience that we're seeing for patients?
Oh, I think it depends which I think you could work it into any specialty. Let me just start by saying that. And I think I jokingly said at work the other day, but I really don't think it's a joke. I think we're going to see the collapse of the medical system in the next 10 to 15 years based on what I've seen. And I think we're going to live it, right? Donna and I, we both teach, we, are inpatient in the hospitals. I don't know too much about your background, Kevin, but I think that if we do not start literally doing the question you asked me, implementing some holistic pieces in care, the system is going to collapse on itself. So what can we start doing? If I got to sit in a big glass fancy boardroom and anybody gave me a microphone and asked me what I would thought, just from my experience being inpatient in, med surg and ICU, would be that first bring it up to people, ask them about their food habits, and ask them about, give them that pie chart with all of the different avenues of health on it, the 7 different ones. And it's an easy rating system. It's actually something, I have a lot of colleagues. I did not personally go to the Integrative Institute of Health, but I know a lot of health coaches that are in my circles that have done that. And one of the things they do is there's a tool, and they literally say, like, put a dot on, and then like on how confident you are, draw it to the outside of the circle, and how confident you are, draw to the inside of the circle. So you can kind of you can have a patient do this in literally 30 seconds. Boom, boom, boom. They think about it and they draw it. And then you go, okay, now we know what this patient is confident in and what they're not confident in. So even if you have a limited time, we say 7 minutes, which they don't spend 7 minutes with our patients in the ICU that are cognitively able to have a conversation. But even if they did, now you know in that 7 minutes either what to say. Okay, we're going to give you some information, right? Because we love to hand people inpatient information packets. We're going to hand you some information on this, or we say we're going to upload this into your care plan in your chart, and on your follow-up with whoever follows up with your care is going to address these points that you don't feel very confident in. And that's just one small idea I have to try to get everybody communicatively on the same page. The other thing is, and I've worked, and even outside of nursing, I've been in home care agencies. I've worked in hospice. I've seen food in a lot of different patient settings for patients. And I have to tell you, the food that we feed people in this country when they are seeking medical care is garbage. And I will die on this platform, but I truly believe we need to start feeding people better in the hospital and in rehabs and in skilled nursing facilities. If you want patients to thrive, you have to fuel them appropriately. So just off the top of my head, those are just 2 basic ones that I don't think would cost the government a significant amount of extra money. Definitely not even doing the assessment tool. That wouldn't cost really any money. Just to better what we're doing already and make it a little bit more synergistic for everybody to get on the same page.
Love it. Love it. I don't think, Donna, you could have aligned what Kelly is trying to do any better there. She could have done a commercial for me right there on the company.
You and Dr. Robert Graham.
That's right. I think that the unfortunate thing, though, is that our time is getting really short to the end, Donna. So if you have any last questions for Kelly, let's make sure that we can get those asked.
Well, I think you kind of did it, Kelly. I was really wanting to know, like, how can we, as a healthcare in general, promote more of whole person, whole healing, whole wellness kind of thing. And I think you nailed it. Like, that was kind of where I wanted to close things up. So is there any last minute thoughts that you would want to say in regards to the individual, the healthcare consumers? What do you want to make certain they leave this conversation with? And then providers, is there one thing that you just want to make certain that they leave with as well?
Yeah, I'll answer it quickly in a 2-part question, because there's something Kevin said literally right in like the first 30 seconds, jokingly about my muscles, about inspiring you. And I know that I'm doing a good job at my job when I can educate, inspire, and empower people. I truly believe, I live my brand. I say it to my husband all the time. We go places. I'm starting to get recognized a little bit places, which is weird for me because it doesn't happen to nurses, you know what I mean? But I'm very on social media and on the line a lot. And I do a lot of community events. And I have to have someone come up to you and say that you inspired them to go to the gym, to eat better, to eat healthier. That is just that in itself makes this worthwhile, and all the work of having a business and working 2 jobs, and it pays for itself. I want to say to to those people, if you need help, we are here. People like Kevin, Donna, and myself, we are here for you. We want to help you. We want to have a conversation with you. We'll get you in the hands of somebody that can help you. You are not lost. All is not lost. And there are always, always options. And you should advocate for yourself in this medical system. You have to, in this day and age, advocate for yourself. Now, I think it's a little bleaker for people that are in the system. And I see this with my own colleagues, that when you feel like your hands are tied, like I did, and that you can only do so much, and that people are not listening to you despite, the research that you're doing and the books that you're reading and the people that you're meeting, I want you to know that you can be the change, and you also have to be the change. You have to try. So there are programs like the AFPA, the Integrated Health Association, School of Applied Functional Medicine. There are things you can do that don't break the bank to supplement either the degree or, whatever career path you're having, if you are passionate about helping and inspiring people to be the change. Because if more of us don't step up and start doing it, I don't know what is going to happen. And I am happy to be a part of it and to inspire other people to do it. And I'm happy to have a conversation with people that want to, maybe explore a career path like I did outside of being on the inpatient world.
Thanks.
I love it. That's fantastic, Kelly. Well, I really appreciate you being on the show and kind of enlightening us to the things that you're trying to do. I think the connections from the hospital world, which you've all enjoyed being in, and the outpatient world is pretty bleak sometimes. It can be a real kind of call to Jesus moment of going, there's got to be a better way for us to be able to help people to avoid ever seeing us inside of the confines of the ER or the ICU. Yeah. And so for you to be able to take something like that, iterate on it, and make it something that now is palatable, all dad jokes intended. I really think that we have the ability now to get those to communities, to get them to people and make them successful. So thank you for doing that. Anybody interested, you can find Kelly on our website, which we'll put on the links below and all of our social pages. And thank you guys so much for coming today and joining us. And we'll see you next time on the Med List.
Thanks, guys.